Auzubillahi minash shaitanir rajeem. Bismillahirrahmanirrahim. Assalamu alaikum and a very warm welcome to World This Morning. I am your host Hajra Satti and joining me is my wonderful co-host who happens to be Fahim Bangesh. Assalamu alaikum Fahim. How are you doing today on this fine morning?
Walaikum assalam, Hajra. As a matter of fact, I'm quite happy because yesterday a very good friend of mine, an old friend of mine called and I had this urge to sing. And whenever I have this urge to sing, I get in a very festive and a very happy mood. So yeah, that has been continuing and even today I'm in a very happy mood. So yeah, I'm doing good. How about you?
Alhamdulillah, Alhamdulillah. And I think we have lots of reasons to be grateful for Allah subhanahu wa ta'ala.
Absolutely.
And especially if you see the weather outside in the Islamabad, you will feel that it's fog, but I don't think so it's fog, it's smog because you can literally feel something pinchy in your throat.
In the throat,
yes. And I wish and hope that we are able to eradicate this very menacing and deadly condition. But
because I happen to be asthmatic and I have had the urge to inhale again and again ever since I woke up today. So yeah, you're quite right there.
Right. And I think in order to tackle this very deadly disease, we need to, the condition or the environmental degradation, we need to link it with the climate change because the COP conference is about to be held, especially in the Dubai, and we are seeing that the world leaders are gathering there, and this is a menace that require a joint and a collective effort of the humanity, because it's not just the specific problem of Pakistan, you're witnessing it across South Asia, across the world, and this is I would say darker skies and uglier smoke. It is impacting our health, right?
And now is the time that we shouldn't be blaming the other countries or neighboring countries. It's time to work together in unison to actually get rid of this problem once and for all, because now it's impacting babies, it's impacting the coming generations, which are to be the future of the country.
Right, and obviously according to the World Health Organization, the definition of health is a very comprehensive and wholesome health, right? It is not just limited to our physical health, it talks about mental health, it talks about spiritual health and the health of the environment. So it has a very comprehensive definition, and obviously when we speak about health, especially when it comes into the physical domain, we are going to talk about a condition that is very prevalent across the world, and it has the precedence especially among the dynasties too, and there are lots of myths that we want to bust in that particular conversations as we develop further in our program. So today we are going to talk about the hemophilia, which is one of the condition, and it is thought about that it usually affects the men, but we will ask that whether it is specifically limited to the men or it is also the condition is also present in the women, because women are usually thought to be the carrier of this particular condition.
And not to forget that this is a blood disorder, it's a hereditary disorder, and there is by far no treatment available. Yes, one can slow it down perhaps, one can do some prophylactic treatment for it, but no complete treatment is available till date in the medical research and everything that's going on in the world Health Organization, in the World Federation for Hemophilia, who's doing a lot about this particular disease. And we will be talking about it. Obviously, we have on the panel today with us very esteemed guests, and we're very happy that they're here with us in the studios. They took out their time. Our first guest is Mr. Cesar Garrido. Cesar, welcome to PTV World, and good morning.
Thank you. Good morning. I'm very pleased to be here.
It's a pleasure.
And the words has been very useful for understanding the situation.
Right.
Absolutely.
And Mr. Cesar happens to be the president of the World Federation of Hemophilia, and joining him is Ms. Rana Saifi. She's also the country head for Pakistan, the World Federation of Hemophilia. Assalamu alaikum and good morning and welcome to our show, Ms. Rana.
Assalamu alaikum and subha bakhair, and thank you very much for hosting us.
Thank you. It's a pleasure. And joining Ms. Rana Saifi, we have Dr. Tahira Zafar. Dr. Tahira is Director, Hemophilia Treatment Center, Rawalpindi. Dr. Saiba, welcome to VTV World.
Thank you very much, Simon. Thank you.
And good morning.
And good morning to you as well, both.
It's a pleasure to have you.
Right, and I think we should start the conversation with the women, because ladies first, right? Okay, so Dr. Tahira, we would like to ask you first about this condition. Is this a disease? Is this a condition? Tell us about the symptoms and introduce to our viewers what exactly is hemophilia.
Thank you very much, Hajra. Very good question, and that is why we are actually here to spread awareness about hemophilia so that people, wherever they are in Pakistan, they know if they have symptoms like that, they can come up and be diagnosed and then treated. So, hemophilia is an inherited bleeding disorders. When I say inherited, that means it runs in genes.
Right.
So, it is present in the, like you said, the carrier, the mothers are the carriers, and then it goes on to their sons. They inherit this disease. So, it is an inherited disorder. And while you mentioned, it is also called the royal disease because it was present in the royal families of Europe.
Yes.
Because Queen Victoria was a carrier and she spread it to her daughters, and then they actually had sons who had hemophilia.
Yes.
And Prince Alexei, who was the son of the Tsar of Russia,
Yes.
he also had it, and some people contribute that the
Romanovs dynasty. Yes.
yes, the problems they had later on was actually related directly to the
Yes.
son having this and the issue of Rasputin and all.
Yes.
But coming back to hemophilia, so it's a royal disease. In Pakistan, it's not just royal because was in the dynasties, but it is royal because it is very expensive. The treatment is so expensive that people can't afford it. So, you need to be a royal or a rich person to actually be able to support treatment of this. So, what actually happens in hemophilia? So, what happens is that there are certain clotting factors. We have 13 clotting factors in our blood who help us in stopping the bleeding.
Right.
Any of the factors, if they are not there, the bleeding will not stop. In hemophilia, traditionally it is factor 8 and factor 9 which are missing, and factor 8 is much more common than factor 9. So, about 80 to 85% of the people will actually have factor 8 deficiency, and about 15 to 20% would have factor 9 deficiency.
Right.
So, when these factors are missing, which actually clot the blood does not clot. So, if you cut yourself like in an ordinary case, the bleeding will stop after a while. We have all noticed this thing in normal people, but in patients with hemophilia, this bleeding will continue, go on till we actually give them the treatment. And then what is the treatment? The treatment is that missing factor. If it is a deficiency of factor 8, you give that factor to the patient,
Right.
the bleeding will stop, because the missing link will actually be the gap will
completed,
be
yes,
filled,
it would be
and if it
bridged.
is factor 9, we need to give factor 9. So, whatever factor is missing, we actually give it. So, one then symptom which the patients have is prolonged bleeding, and similar symptoms they can have, like in babies, for example, they bump themselves, small bumps will give them bruising. So, parents will notice that the baby has got abnormal bruising from here and there. Then bleeding from other areas as well, bleeding from the nose, bleeding from the gums. And in hemophilia, when the children start walking, that is the time around 2 years or a little over 2 years that they start having the joint bleed. So, the characteristic thing of hemophilia is joint bleeding, and that happens both spontaneously and after trauma. So, this poor child comes up with a huge swollen joint, and that is how at times the child is taken on to a doctor who diagnoses. In Pakistan, it is slightly different. We have actually have the tradition of getting the boys having circumcision.
Yes.
So, we have been able to pick up these children early because of the circumcision practice. When they have circumcision, because of the missing factor, they will bleed excessively.
Oh my God. Okay.
And unfortunately, we have had a brother brought down after the elder brother actually died, unfortunately, because of due to bleeding post circumcision.
Oh my God. Right.
I mean, it is so important to recognize it early. So, this is what hemophilia is, the missing factors. What are the symptoms? These are the symptoms. Then you need to diagnose. So, if somebody has these symptoms, he is taken on to a medical doctor, he would actually ask for some tests.
Right.
And what are these tests? These are coagulation tests. So, I do not need to go into details, because from the patient point of view, it is not important. They do not need to know what
Right.
test. It is the doctors who need to know what test to do. And mostly they are then referred to a specialist who will do these tests. They are available in Pakistan. They are available in army setup and in many private laboratories as well, and then this is diagnosed.
Right. So coming to you, Mr. Garrido, so we've seen, like Ms. Tahira talked about, that living with hemophilia is not an easy task, right? And what do we do but it can be cured with the modern sciences and the research, but what do we do when the odds are stacked against it? And obviously our access to healthcare, our access to education, our access to economic stability all affect our health, right? So what exactly is the World Federation of Hemophilia doing it to make the healthcare access more accessible and universal, especially in Pakistan?
Yeah, well, very well explained by the Dr. Tahira. So the World Federation of Hemophilia is an international organization, umbrella organization, that 147 countries. So we have the expertise and many expert volunteer that is possible to help Pakistan. She described the current situation in Pakistan, so that could be much better treated and the comprehensive care in any other place of the world. We have many examples to share with you. So the WFA pretend to undertake a big program by 5 years. We call PAC, is Path Access to Care to Treatment.
Right.
And that is possible because we need to establish several strategies here. That is the reason our visit now. We visited Karachi, now Islamabad, and after tomorrow we are going to Lahore.
Right.
Trying to prioritize with the needs, okay, but it's impossible everything at the same time. But step by step, it's possible to improve even more. With education, as you say, with training to the healthcare providers, not just the hematologists. The lab is essential to build a strong lab with technicians, because the diagnosis is important. When you have, in this case, for example, that Pakistan is 70%, approximately 70% of the people with hemophilia estimated is registered. So the gap is too big between the estimated and registered. Where that is something that you need improve even more in that aspect.
That's true.
And then to give them medicines.
Right.
Nowadays it's possible in many countries, even in less possible situation than Pakistan, really low-income countries, this kind of the situation has been changing. The hemophilia at the moment, thanks God, has been possible to have available many products, safe products, medicines, therapy, in many cases cheaper than the people think. That is part of our intention to help the country. The World Federation works usually address the efforts to the state, to the country, to the nation, not to a specific person. It's to the trying to help to design a right policy in order to help this kind of the people.
Right, and Ms. Sefi, coming to you, since you're a country director of the World Federation for Hemophilia, have you had a chance to move around Pakistan, especially in the rural centers of Pakistan? Because definitely when we're talking about the treatment of hemophilia, when we're talking about the symptoms and creating more awareness, Pakistan is a country which often comes across many problems like floods, like earthquakes, right? So definitely the health centers in the rural centers and the less developed areas, they get affected. And similarly, the patients with such diseases also get really, really badly affected. So could you share your experiences of moving around the country and looking at different aspects of society and how people are looking at this disease?
Thank you very much, Fahim. I'm the regional manager for the Middle East, and Pakistan is one of 21 countries that we manage.
Right.
This is our first visit to Pakistan.
I see.
Even though the National Patient Organization has been a member with the World Federation of Hemophilia since the year 2000. So this is the very first visit we make to the country. However, to answer your question, we work with the national member organization, the National Patient Organization, which is known as the Hemophilia Foundation of Pakistan. And that is an umbrella body for 5 different chapters, of which the Hemophilia Welfare Society of Rawalpindi is. There's one in Karachi, one in Lahore, and one in Peshawar, and they've recently added one in Quetta. So the way that we reach out to the people outside of the city centers is through the work of the different chapters of the Hemophilia Foundation of Pakistan. You are right that services in remote areas are worse than services in city centers. And that is something that is quite important to look at when we talk about the organization of care. It is extremely important for the country to establish a network, both of what we call a comprehensive care center, and I'll come back to define what this is, and then a series of hemophilia treatment centers and satellite centers at district level to be able to link the patients immediately to places where they can be diagnosed and places where they can be treated. And I would like to go back to 2 points that Dr. Tahira and Mr. Garrido mentioned. Dr. Tahira gave the example of a child who has been circumcised and who has not been immediately diagnosed and who died. And it was when the second child was circumcised and had a bleed that that family knew that they had hemophilia in the family.
Right.
Mr. Garrido talked about the importance of early diagnosis.
Yeah.
This for us is the very first step, that you are able, when you go to an emergency ward, that the emergency ward staff are immediately able to suspect that a child who is bleeding might have something called hemophilia, and then to refer them to a specialist and to a lab who can say whether or not this is the case. That is a very, very important thing. It's about education of the medical professionals across the board, but more importantly in emergency settings, because that is often the very first point of when somebody, a child who's bleeding, goes to. It's extremely important to educate healthcare professionals at all levels to suspect that there is something called hemophilia, and then to equip the labs to be able to undertake the necessary lab diagnosis to tell us whether this is hemophilia or not, whether this is hemophilia A or B,
Right.
and then to refer them to a comprehensive hemophilia treatment center that is able to give them the treatment, and there's a precondition for that, I'll come back to it, and then who is able to counsel the family and tell them that there is no taboo in having a child with hemophilia because there is a treatment for it. So if we improve access to care and treatment, a person with hemophilia can live a perfectly normal life that is no different to anyone else in society.
Right. And also now, Dr. Saiba, talking to you now, usually when it comes to hereditary diseases, they say there is a recessive gene, there is a dominant gene, right? But here we're talking about only males getting affected. Now, I want to ask, A, whether there has been any case of any female getting hemophilia, and secondly, whether there is any recessive gene of hemophilia present in the males as well.
Yeah, this is slightly tricky in a way because males have only got one X chromosome. The hemophilia gene is on X chromosomes. So since the females have two X chromosomes, the normal one actually compensates for the abnormal one. But men only have one X chromosome, that's why they get the disease. So coming on to what Rana has actually said about hemophilia, I think it's very important for us to realize that a person with hemophilia, if treated properly, can live a completely normal life and appear completely normal, like you've just seen the Mr. Abbas Zaidi. So it's very important, the various factors which we need to get organized in Pakistan is first, only about around 17 to 18% of the total hemophilics in the country are actually recognized. So we need to get hold of the slightly over 80% of the patients with hemophilia who are in the country. Once we identify these people by awareness and outreach, we need to diagnose these people, and for the diagnosis of these people we would need labs with tests which we are able to pick up them. Once they are picked up and diagnosed, they will need treatment, and for those we need treatment center. And in Rawalpindi, Islamabad, we are lucky in a way that at PIMS there is a designated hemophilia treatment center both for the children and the adults. But the thing is that they do not actually have those factor concentrates which I was telling you.
Yes.
So we have a nucleus which is very good in a government hospital because it is the only government hospitals in the country with the Hemophilia Treatment Center. We are actually going to be meeting the executive director of PIMS and the minister as well to emphasize to improve facilities in a government hospital, because presently the setup with the NGOs looking after hemophilia is not sustainable. What we really need is a sustainable solution to this, so that our children can live a normal life.
And Mr. Garrido, coming back to you, so Dr. Tahira talked about a sustainable solution. Firstly, I would like to ask, what exactly have you guys in mind when you talk about sustainable solution? And secondly, obviously, according to statistics that you provided, 80% of the patients remain undiagnosed in Pakistan. And also, let's talk about the social determinants. How do they affect the data collection, especially within the Pakistan?
Well, in many the strategy must be implemented with the trying to improve the awareness on the society as well. So that is something that is part of the role of the patient organization. We have to educate the patient what hemophilia is, what does hemophilia, and at the same time how it's possible to, as Rana said, that to acquire a normal life. In parallel, the strategy is to teach the lab technician in order to determine and to obtain a accurate diagnosis properly, because it's essential for the rest of the life. Even we have at the moment several news that the potential functional cure of hemophilia, anyway, we have the person who has hemophilia will have hemophilia the rest of the life.
Right.
But the point is that the patient can develop a normal life, as Rana said. So when you have this kind of gap so big, it's something that is looks like the worldwide. I mean, the media is 20% of the whole population in the world is who has been diagnosed. That is a challenge for the WFH. But in Pakistan, 70% is worse situation than the rest of the world. But we have many countries that over 100%, over 100%. You know, that is part of the challenge that is impossible to do without the participation from the society, from the patient organization, from the treaters, and from the health authorities, the state. So in order to be sustainable, we need to put together all these elements held by the WFH. We can donate medicines. Actually, we have been making donations to medicine, but not to make donations just in case. It's that to train the treater, to train the patient, and to train the healthcare providers.
And one last question, Mr. Anasefi. Are we looking forward for a collaboration with the government in order to create mass awareness in people in terms of, say, electronic advertisements or telephone advertisements or even telemedicine for that matter, because each and every person owns a mobile phone today in Pakistan,
and
right?
Community outreach, yeah?
Exactly. So are we looking for a liaison like that with the government?
So in the WFH, we talk about a golden triangle, and the golden triangle usually involves the patient organization, the healthcare professionals, and the government together. In Islamabad, there is a clear manifestation of that collaboration. As Dr. Tahira mentioned, you have treatment available in PIMS and also in the Rawalpindi University and also in the Armed Forces bone marrow transplant setup. So in terms of patient education, there is room definitely for collaboration between the three parties to raise more awareness about hemophilia and the recognition of hemophilia. There is also room for greater collaboration building on the existing fantastic efforts that have been made to improve access to care and treatment. We talked earlier about diagnosis. Diagnosis is available in Pakistan, but it is in the private sector, and it is mostly in the private sector apart from the armed forces, and it is costly. So we need to make sure that diagnosis is affordable to the persons with hemophilia. We also talked about access to treatment as a precondition for the persons with hemophilia to live normal, healthy lives. And that also requires closer collaboration between the three parties to determine the exact steps to ensure that access to safe, secure treatments is available to all persons with hemophilia. We often talk in the WFH about treatment guidelines and the adaptation of those treatment guidelines to the realities of each country. The golden rule for a person with hemophilia is that they should receive treatment before they have bleedings to prevent that bleeding.
Yes.
We call that prophylaxis.
Prophylaxis,
And
yes.
our vision, the WFH vision, is to have treatment for all persons across the world in the 147 countries that the president of the federation mentioned we work in. The vision for Pakistan needs to be that each child with hemophilia has access to prophylactic treatment so that they don't bleed, they don't develop joint complications, they don't develop disabilities, and that they can live normal lives.
Right, and thank you so much for giving this very beautiful message.
And we hope that vision is realized sometime in the future.
True. And because I think I'm really proud of the fact that our state, despite being under-resourced, is trying to make the access towards the healthcare universal and free. And with that, we would like to wrap up this segment, but we will continue to unfold and unpack this conversation surrounding hemophilia in the next segment too. But we're going on a short break, and before going on to the short break, we would like to thank you, all of our esteemed and worthy guests, for coming here, for having this wonderful conversation. Thank you so much, all of you.
And thank you very much, Hajar and Fahim, for hosting us.
Absolute pleasure.
It was a pleasure. And now we're going on a short break, so don't go anywhere, because when you come back, we will continue to unfold and unpack the conversations regarding hemophilia.
Stay with us. And welcome back to World This Morning with Hajar Sethi and Fahim Bangish, and we were talking about hemophilia. Quite a manageable disease, as we got to know in the first segment when we were talking about the disease with our esteemed guests. And now in our second segment too, like Hajar said, we will be unfolding this conversation and debunking a lot of myths about it as far as the physiological, psychological impacts are concerned. As far as the policy development in the country is concerned, we will be talking about that. Now, before that, I would love to introduce our guests today. First of all, we have Dr. Lubna Zafar. She's President, Hemophilia Society, and is a hematologist. Dr. Saiba, welcome to World This Morning.
Thank you very much for having us here.
Pleasure.
And joining Dr. Lubna, we also have Dr. Philip T. Mollos. He happens to be the Faculty of the Medicine, Geneva in Switzerland. Welcome to our show, sir.
Nice to see you both.
And lovely having you, sir. Joining Dr. Mollos, we have Mr. Abbas Zaidi. He's the President, Hemophilia Foundation, Pakistan. Zaidi Saab, Assalamu alaikum and good morning.
Walaikum salam. Hajra, Fahim, it's nice to be here. Thank you so much.
Pleasure.
That's wonderful. So, Dr. Lubna, we will start the conversation with you, because ladies first, obviously. Dr. Lubna, people or persons who are diagnosed with hemophilia, especially the children, let's talk about them, because they are advised not to play much and especially engage in lots of active physical activities because of this condition. So is this a myth that should be busted, and do you think the medical sciences has researched that much that they can live properly a normal life in their young age?
Actually, with the treatments available now in the developed world, they can live a normal life.
Okay, that's wonderful.
Means that they don't have to restrain themselves from physical activity like we are doing still in our country. The reason is that we don't have the treatment to that level that these patients can be given a free hand to do whatever they feel like. But with treatment, perfectly normal, near normal life they can have. They can even play these contact sports which we tell them to avoid.
Right.
The reason is to prevent injury so that they don't bleed, which we don't have resources up to the mark to treat. That is why we tell them to restrain themselves from physical activity so that they don't have these joint problems which can lead to disability later on.
Right. Now, Dr. Mollos, since you're from the Faculty of Medicine in Geneva, right? WHO is also in Geneva. A lot of talk and discussion on the overall medical research is conducted over there, right? This is also something of great concern, not just in Pakistan, but the entire world. So what sort of policy formulation is expected from the government of Pakistan? What sort of coalition is expected? What sort of facilitation is expected from the government of Pakistan in order to particularly treat these sort of patients? Because like Hajra was mentioning earlier as well, 80% of the population is still undiagnosed.
And what sort of conversations we need to further have that should
Exactly.
be guided by the research in the first place, since you deal with the research and you deal with the faculty and you're part of the Geneva?
And it's not really the position of Geneva, but it's, let's say, the developed world, the different situation
The global
between
north, yes.
what we are able to do, what we can provide to the patients, and the situation right here. From the few days I was here in Karachi and now here in Rawalpindi, the main observation are, the first one, there are very knowledgeable people here. Lubna is an example, Tahira also before is an example, and Habas as a patient also, he is very well educated. So the persons have the capacity and the capability to follow all the program and to do all the right things. Next point is the availability of factors and the general organization.
Right.
And that's why they provide guidelines, and the national organization in Pakistan, they are doing guidelines step by step. We should do that 1, 1, 2, 3. You already heard before the main gaps which are to be fulfilled here. And from what I saw, it is really a battle between the private sector, what the private sector is doing, which is not sustainable, and what the government should endorse in order that to make the thing sustainable. And to create in some hospital, there is one example we'll see today, and really to focus, to bring the competence to have a real multidisciplinary team in one place. Apart of that, the next point I would like to say in order to join the first question, how the children are living now and what, they need to be able to have a home treatment, to be independent, to be autonomous. And for that, you need good product, not what it's called cryoprecipitate. It's a little complicated, but it depends. If you have a cryoprecipitate, you need to go to the hospital. They have to be treated at home. And you ask question concerning the rural area, and which is not close to a big city. I mean, what do? They have to come here, they have to pay taxi, they have, etc. All these things could change and will change sooner or later, again, because the knowledge is here. By providing the right concentrates they can have at home, they can infuse themselves. Because if you are a child, for example, you are the mother or the father, your child is bleeding in the knee, for example, it's really painful. You have to wait 3 or 4 hours to go to the hospital. You lose 3 or 4 hours, and the disaster starts. And this articulation will be worse and worse and worse. So if you have a known treatment, and next you do what we call prophylaxis, you will hear this word all the time. Prophylaxis means to give regularly treatment in order to avoid a complication.
The symptoms, right.
The real difference is between what we call on-demand treatment. You have a bleed, you go to the hospital. No, it's not a good solution. Really, you do that before, and once a week, twice a week, depending the products that you have. Now it's once per month. We change life. I mean, all our objective is the quality of life of the patients, as much as normal as possible.
Right, definitely. Now, talking to Mr. Abbas there, the Abbas, like we have been told, you are a person with hemophilia, and staying with hemophilia is quite a taboo subject when we talk about it. And like Dr. was also mentioning that dependability, dependence, not having independence, and just the thought that you're dependent on people, you cannot do things independently, that's quite... your mentality is clipped, you yourself are clipped, but you got out of those clutches, and you, mashallah, are President Hemophilia Foundation Pakistan. You came out of those clutches. May I ask, how did you even do that, especially in Pakistan where we don't even have support groups?
That's an interesting question. I'm still getting out of those clutches as we speak. But, what happens is I was lucky enough to be born in an educated family. And, first, the hemophilia problem is understood by your parents,
Right.
and then it is transferred to the child. So if you live in a rural part of society, or you're not educated enough, if your parents don't understand what you have, how will you expect the child to be, to know what he has? So it's a very, very difficult journey, understanding it, growing up with it, and living in a place where, the only hope that you have is a patient organization made by patients themselves, which through their own meager resources help the patients out. So I was born in Karachi, based in Karachi, and we have this patient organization there called the Hemophilia Welfare Society of Karachi. After I understood my situation, and when I understood that I am in a family where I'm educated, I have a voice, and I can, raise my voice at a platform, then I realized that there are 25,000 hemophilia patients that need this voice, because there hasn't been any effort by the government, by any healthcare providers or treaters to understand or do something about hemophilia. So it's just us patients who have to stand up for ourselves. And this is basically what gives you the confidence to get out of those clutches that you mentioned. But yeah, there are serious challenges, because as Dr. Lubna mentioned, that these children cannot play. There are several issues related to emotional development, related to physical development, that us patients have to go through in our lives. And what happens is that once you don't have the resources, you kind of missing on education, missing on physical development. You ultimately become an increasing burden on your family, because you cannot work. Nobody because there is no mass awareness, nobody recognizes that you have hemophilia or what is hemophilia. So it's challenging. But as we patient organizations grow, as we understand what is required to be done, what is needed, is that there should be a tri-party partnership between the WFH, the government, and the patient organizations working here, so that we can ensure the proper measures in the government hospitals, so that people who are recognized with hemophilia have a proper way to lead life, have counseling, have preventive measures available, have diagnosis available, have treatment setups in the same place that they're going to. So it's very, very difficult, but it's doable.
Right. And Dr. Lubna, now let's explore the aging and the hemophilia, because obviously there are lots of burdens and the uncertainties of the longevity. But obviously with the research, with the medical sciences, the progress in that, we've seen that once that there was a taboo that the people can't live long with hemophilia.
Yes.
But obviously there are lots of people who experience the comorbidities with the hemophilia, like the heart health and renal diseases and whatnot. Since you are the doctor, so please explain us all of these aspects of and the concept of frailty which comes with the hemophilia.
Yes, thank you very much. It's a very pertinent question. Actually, there is no frailty.
Okay.
If you get
this
the
is a myth
treatment,
that should be debunked. Yes.
Okay. If you get treatment, you are fine. Like you see Abbas here.
Wonderful.
So that is number one. And the problem mainly is that treatment, the optimal treatment is not available. Like Dr. Philip mentioned, that we should be giving them prophylaxis, means that raising their factor level up so that they don't bleed. That is prophylaxis. So we are doing a very limited prophylaxis because we don't have factors.
Right.
So right now our focus should mainly be on provision of these factors in our government hospitals. The government needs to take on this responsibility. We should not be, we are grateful to WFH, but this is not a sustainable long-term solution for the problem. Our government should be taking up the responsibility, and these facilities should be in the government hospitals. Not only the NGOs should be taking care of that. Now, the other part is even more important, that the psychological pressures which come with that. We have seen the limited numbers we have treated with the low dose prophylaxis here in Pakistan. We have seen the change in them. The mental attitude that changes. They become confident. They don't lose. They are not absent from schools, and they are growing up normal emotionally, I would say. So that is again very important. And just a minute more, we don't want to leave the women behind.
Right.
Hemophilia is definitely we have talked about it, but then females also have their issues, and von Willebrand disease is at the top.
Right.
Yes.
That is another, the one which you have actually shown the
visuals, yeah.
Yes, visual. So this von Willebrand disease is again a factor. Von Willebrand factor is missing, and both boys and girls, because autosomal disorder, autosomal recessive disorder this is. So we are females, they are type 3 von Willebrand disease, which is the severest form. So they actually suffer in silence.
Right.
So we have to give them a voice
Right.
too.
Right. So, Dr. Morlos, because of the paucity of the time, I would like to ask you, what message would you like to give, especially to the people out there, the stakeholders out there, against this particular condition called hemophilia?
If I can just come back, first I would like to congratulate you to have done this emission, because you bring a patient. It's really a partnership.
Right.
He mentioned the name. It's finished the medicine, generally speaking. The doctor knows, the patient doesn't know, especially in chronic disease. They know better the disease than we do.
Right.
Exactly.
And it's very, very important. That could be one of the first message. The second message is linked to your question. The life expectancy now in our country is the same for person with hemophilia versus normal person.
Right.
Exactly the same now.
Right.
So that means if you have the appropriate treatment, and you will be able to have a normal life, no absenteeism to the school, you can work like all the work, etc., etc. And my message to the person with hemophilia or other bleeding disorder living in Pakistan, be courageous. The situation is changing. Through Lumna, through the patients' organization, through Tahira you saw before, and with the help of the World Federation of Hemophilia, the situation will change relatively quickly. There are many new treatments coming.
Right.
Less burdensome than the one, because you have to do like that, puncture. Now it's subcutaneous. It will be at a certain time like that. Cure is coming. Cure is coming also. So if I am in front of a family with a young child, I tell them, okay, the situation is difficult now, but it's changing quickly, and it will be true in Lahore, in Karachi, in Islamabad, and in the whole country.
In the world.
Country.
Quite right, you are, sir. Well, sooner or later, as our panel members were saying, there will be a cure. Sooner or later, Pakistan will get out of the clutches of hemophilia. People will lead a normal life. Even in Pakistan, the life expectancy of a person with hemophilia is going to be the same as a normal person. With this, we will come to the end of our program for today. You people, stay put, stay together, stay motivated from many inspirations that we can draw from many of the people who are around us. Thank you for joining us. Allah Hafiz from Hajrat Satya and Fahim Bangush.